Welcome to today's discussion. We're diving into the complexities of hypoglycemia, a condition that significantly impacts individuals with type 1 diabetes.
Hypoglycemia can have severe consequences if not addressed promptly.
Many people are unaware of the subtle ways hypoglycemia can manifest. What are some of the early warning signs that individuals should be aware of?
Sweating, nervousness, tremors, and a rapid heart rate are common initial symptoms. However, it's crucial to remember that these can vary widely depending on individual factors.
And what about the more severe consequences if left untreated? Let's start with a basic definition. What exactly is hypoglycemia, and why is it particularly dangerous for those with type 1 diabetes?
Hypoglycemia is defined as abnormally low blood glucose levels, typically below 40-50 milligrams DL. In type 1 diabetes, the body's inability to produce insulin, coupled with insulin therapy, creates a delicate balance. An imbalance can easily lead to dangerously low blood sugar. It's the most dangerous acute complication, potentially leading to impaired cognitive function, seizures, or even coma.
In healthy individuals, what natural mechanisms prevent hypoglycemia, and why are those with diabetes more vulnerable?
Healthy individuals have a sophisticated system of counterregulatory hormones that kick in when blood sugar drops. These hormones stimulate glucose production in the liver and reduce glucose utilization. However, in type 1 diabetes, the system can be impaired, and the use of exogenous insulin further increases the risk of hypoglycemia. Missed meals, increased physical activity, or even excessive insulin doses can trigger episodes.
You mentioned the variability in symptoms. Can you elaborate on the clinical features of hypoglycemia?
Symptoms depend on several factors, including the rate of glucose decline, age, gender, and overall health. While sweating, nervousness, tremors, rapid heart rate, and hunger are common, neurological symptoms like confusion and seizures can also occur in more severe cases. A particularly dangerous situation is hypoglycemia unawareness, where individuals don't experience typical warning signs.
Hypoglycemia isn't exclusive to diabetics. How is it categorized and caused in non-diabetic individuals?
In non-diabetics, we see postprandial, after meals, and fasting hypoglycemia. Postprandial hypoglycemia can result from alimentary hyperinsulinism, often after gastrointestinal surgery. Fasting hypoglycemia arises from an imbalance between glucose production and utilization, potentially due to hormone deficiencies, enzyme defects, liver disease, or certain medications. Excessive glucose utilization can be caused by conditions like insulinomas.
How is hypoglycemia diagnosed?
The primary diagnostic test is measuring blood glucose levels, ideally before treatment. Fingerstick tests provide quick estimates. Further tests might be needed to identify underlying causes, such as checking for alcohol or drug ingestion.
Whipple's triad consists of symptoms of hypoglycemia, documented low blood glucose levels, and relief of symptoms following glucose administration, and it is crucial for diagnosing insulinoma.
What are the management strategies for hypoglycemic episodes?
For mild cases and alert patients, oral intake of sugar is sufficient. If oral intake isn't possible, intravenous dextrose is indicated. For children, lower concentrations of dextrose are used. If IV access is delayed, intramuscular or subcutaneous glucagon can be administered.
What about patient disposition and follow-up after an episode?
Patients with uncomplicated hypoglycemia can be discharged after the cause is addressed and education is provided. A meal before discharge is crucial. However, recurrent hypoglycemia, especially related to certain medications, may require hospitalization.
Why is timely diagnosis and management so critical?
Prompt management prevents serious complications like cognitive impairment, seizures, and coma. Healthcare providers must be vigilant in identifying causes and implementing appropriate treatment strategies. Effective management improves patient outcomes and reduces risks.
Are there any other crucial aspects of hypoglycemia management that we haven't covered?
Patient education is paramount. Individuals with diabetes need to understand their risk factors, recognize symptoms, and know how to respond appropriately. Regular monitoring of blood glucose levels is essential, and close collaboration with healthcare providers is crucial for personalized management plans. This includes adjusting insulin doses, meal planning, and addressing any underlying medical conditions. Early recognition and prompt treatment are vital to prevent serious complications.
Thank you for sharing your expertise. This discussion has provided invaluable information for our listeners.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.